Schizophrenia is a mental illness that affects the thinking, feeling, and the behavior of individuals. Schizophrenic patients often suffer from a broad range of symptoms. In the following, we will investigate what symptoms are generally possible and an outline for symptomatic unfolding in schizophrenic patients. Symptoms of schizophrenia are most often classified into positive and negative symptoms. Positive symptoms are absent in healthy individuals, while negative symptoms are expressing the absence of characteristics that would normally be present in healthy individuals. Positive symptoms include hallucinations, delusions, confused thought, and abnormal motor behavior. Hallucinations mean that a person sees, hears, smells, tastes, or feels things that are not actually there. The most common hallucination in schizophrenic patients is that they hear voices. Those voices can be friendly, though they are often critical, rude, and annoying. Research indicates that the brains of schizophrenic patients may in fact mistake thoughts for real voices, such that they feel very real to the patient. Delusions mean that an individual believes in something mistakenly or with a strange or absurd view that is not validated by events in the world. An example is hearing voices describing an individual's actions and the following belief that someone else monitors their actions constantly. Impaired cognition can include general problems with attention, concentration, and memory, and can lead to declining educational performance. Confused thought is another characteristic of impaired cognition. Individuals have trouble following their own thoughts and conversations, and may answer with unrelated topics and things that don't make sense. This can cause significant problems with normal communication. Abnormal motor behavior can be either a positive or negative symptoms depending on the manifestation of it. Common are repeated movements without purpose or restlessness of body. This can cause significant problems in daily activities. Another example for abnormal motor behavior is catatonia, where individuals move little to none and show no response to the environment. This leads us to negative symptoms. A negative symptom is very low energy and lot of time spent passive. An extreme case of that is the previously described catatonia. Other negative symptoms include the disconnections from their own feelings and emotions, trouble of feeling pleasure in everyday life, and the avoidance of social interactions or interacting in socially awkward ways, and this even includes the closest friends and relatives. Now we know the possible symptoms of schizophrenia. Schizophrenia may develop slowly in individuals, and negative symptoms are often developing months to several years prior to the onset of positive ones. In some individuals, acute phases of schizophrenia alter with phases of little to no symptoms, while in others, symptoms get incrementally worse over time. It is important to note that not all symptoms have to be present in an individual, and that different individuals can express a different cluster and a different combination of those possible symptoms. People often think that schizophrenics have multiple personalities, but this is a confusion between schizophrenia and DID, the dissociative identity disorder. DID patients have two or more distinct personalities by definition, while this does not hold for schizophrenics. Schizophrenia is largely considered a genetic or neurodevelopmental disease, while DID is trauma-induced, where the trauma causes the dissociation or split-off of full identities. We now know that symptoms of schizophrenia include hallucinations, delusions, cognitive impairment, and abnormal motor behavior that make up positive symptoms, flat effect, low energy, disconnection from emotions, and social avoidance that make up negative symptoms. The negative symptoms may arise before the positive ones do, and the disease may unfold differently between different individuals. We also know that schizophrenic patients do not necessarily have multiple personalities, and that schizophrenia is not to be confused with the dissociative identity disorder. I hope you have learned something, and please take a look at the reference section for further information.